If your morning breath could knock a buzzard off a crap wagon, I've got news for you. What you brush off as garlic breath or cotton mouth could be a disaster waiting to happen. That whiffy whiff might be more than just last night's tacos talking. And if your breath smells like it could peel paint off a wall, it's time to stop blaming the onions and start investigating. Case 1. According to a report in Semantic Scholar, a 10-year-old boy had persistent halitosis for 5 years so horrible that it isolated him socially. Doctors found a giant rhinolith, basically a stone growing in his nasal cavity from mineralized debris. That thing stunk, and no toothpaste would touch it. Removal was surgical, and the kid's dragon breath vanished, and he resumed a normal life, and even got a date to prom, last I heard. Case 2. In Rheumatologia Clinica, a woman with Sjögrens Syndrome suffered daily bad breath so intense she drank water constantly, even at night, could not sleep well, and felt judged wherever she went because flower bouquets would wilt in her presence. Tests revealed dry mouth, xerostomia, and damaged salivary glands, despite her oral hygiene being good. Treating her systemic condition medically eventually eradicated the stench trench, and she went on to live happily ever after. Case 3. As documented in GP Online, a businessman in his 40s tried every mint and mouthwash and all the OTC stuff, but his breath got worse. Turns out he had advanced periodontal disease and a rotten, neglected dental abscess that leaked odor-causing bacteria non-stop. The corn niblets he called teeth needed deep cleaning, surgery, and antibiotics. Thankfully, his breath's reign of terror finally ended after professional intervention. These are real people, really suffering, because bunker breath is not just embarrassing, it can signal serious disease. If you're like most people, you can avoid the stink whisper by brushing your teeth. And tongue at least twice a day. Floss daily. Use tongue scrapers. Don't smoke. Stay hydrated. Chew sugar-free gum. Switch to alcohol-free mouthwash. And avoid trigger foods like garlic, onions, and strong spices. Keep dentures or retainers clean. And replace that beat-up toothbrush every 3 months. Brush with greatness, not garbage. If bad breath lingers for days, smells like rot, and is associated with bleeding gums, cracks, pus, or pain, see a dentist or ENT specialist right away. Professionals will examine your odor oven for periodontal disease, dental abscesses, or ENT issues like rhinoliths or tonsil stones. They may even prescribe deep dental cleaning, antibiotics, or even surgery to help excavate. However, if your bad breath is mild and improves with daily care, great, keep those habits strong. But if you continue to notice breath your dog tries to roll in, along with pain, pus, bleeding gums, or swelling, do not ignore it. That is the moment to call in the pros. So treat the simple stuff at home. But if people keep backing away from you, like an open dumpster on a hot day, don't be stubborn. Get medical help fast. Your health, breath, and anyone within a 3-foot radius will thank you for it.